everyone. Welcome to my first podcast ever. We're here at Dr. Duku Clinic. It's not a very original name. Back then, I was a bit narcissistic. I'm here with Dr. Aslan. We're going to talk about the procedures that we do. Jokes aside, we actually help people. I think not enough people are informed about what we do and how we can actually help people. Over 90% of our procedures are revisions. What does a revision mean? It means that we get patients that had surgeries or procedures, most of them several, not just one, and they're at a point where they don't know what to do. What do we offer? We offer procedures that fix their issues and improve their life without making them trade their time. So you don't have to recover 2-3 months after a revision where you already lost a lot of time of your life because of loss of confidence, trauma, and recovery from the other surgeries. Am I right?
Yeah, absolutely. Absolutely. There's a lot that I've learned in my short time with yourself that, has shown me that the outside view that people have of aesthetics is not necessarily true. Even myself when I came here, my view was let's see what's going on. And in my time I've found that actually we're not looking for vanity. We're trying to help people put a smile back on their face when a lot of them have gone through a significant event that's led to less than beneficial outcome for you. I come from a completely clinical background where sometimes cosmesis is almost disregarded. It's interesting. It's been interesting for me to see the other side of things where, how it's actually impacted patients.
Now, you've been with me and without me in a lot of consultations, and you've seen most of our patients. What are they looking for?
Yeah, it's an interesting one. So the majority of our patients so far, with you, without you, are looking for improvement, right? Improvement, though, can be broken down to a couple of things. Everyone's got a history and a past of their medical issues or their own body image issues. So when they present with us, they're either got a specific problem area with a complex history. There are a couple of patients we've seen together who have had previous procedures that have had a less than positive outcome for them. Maybe they're a little bit uninformed of the risks because, unfortunately, not all practitioners are sort of as open as they should be about certain risks. So then they've come to us, and I think most of the time we've been able to offer them a very balanced and fair view of what we can and can't do, which I think sets Dr. Duke Clinics apart from a lot of other places. And we're not afraid to say, actually, no, we're not miracle workers. We can help 50, 60, 70%, but you're going to have this much degree. However, I must say I have seen some of miraculous results in the time that I've been here. Obviously, we do have the subset of patients who come and say, look, this purely cosmetic, which is also reasonable. And I think, as long as we continue to be treating them in an ethical and a fair way, there's no issue. Everyone's got something they're not happy about. And if we can put a smile on their face, then why not?
I completely agree. Most people, obviously, liquid BBLs have a really bad name. One of the reasons being regulation is almost non-existent. There are, let's just say, guidelines, but they're not law. So because of that, you have a lot of people that have no medical background. Actually, not so much recently, but in the recent past, you have a lot of people with no medical training, no medical background, doing procedures, unhealthy people, and who are looking for a cosmetic improvement. And obviously, every procedure has a risk. If you think about the risks, the main one being infection and embolism, although embolism is, from my point of view, and again, there are a lot of people who contradict me, a lot lower risk than the theoretical side that says it is. The main risk from my point of view is infection. So sterility is very, very important. So obviously we've had a lot of horror stories in the news with really bad infections and sepsis and people whose bodies or faces got disfigured. The reality is a bit different. What does it mean? If you have a trained doctor or nurse And yes, for complications, even a trained nurse will require this backup of a doctor. It is the truth. But if you have somebody trained, they will detect the complications very early. And when you detect them early, the solutions are a lot easier and a lot more tolerable for the patients. And I would say in a very large majority of cases, we will not have to even end up in the hospital. That being said, the other side is this. There's so many patients that have been disfigured congenitally. What does congenital mean? They've had They were born with certain defects. They've had several surgeries to fix those defects. Sadly, nothing works 100%. So, in a lot of patients, those surgeries actually improved very little or nothing, but the trauma of the recovery quite strong. We have patients that had cosmetic surgeries, and those cosmetic surgeries ended up with complications that disfigured them. And we've had patients that had non-surgical procedures that they ended up disfigured. And we're talking about the whole body. So hyaluronic acid is an amazing product. Why? Doesn't require vascularization to volumize. So when it comes to reconstruction, to revision, every time a flap or fat won't work, we will be able to use hyaluronic acid, or let's say almost every time. And it has this beautiful effect of not keeping somebody in bed, hospitalized, not keeping, you can literally enjoy your normal life. You just have to avoid gym, alcohol, sauna, and hot baths, which is, I think, an amazing plus for people that have lost a lot of time. And it is my opinion that time is the most valuable thing we have, maybe time and health. Now, another thing that we do and that we offer is we are able to treat skin laxity and fibrosis without creating big scars through a minor procedure that again doesn't keep you bedbound, and as soon as we finish you can go and have your dinner in a restaurant. Most patients that come to us with this problem, skin laxity and fibrosis, either had a liposuction, or they had a tummy tuck, or they had childbirth, or there's a lot of patients that have volume loss through overuse of GLPs, of peptides for weight loss. Now, those patients, if they have to go through surgery, besides the fact that the scarring can be quite visible, recovery is intense, and also complications can be quite bad and quite frequent. So, as I was saying when we started this discussion, we are able to help people that need help without asking them to give up time, quality time of their life. And most results are quite fast, between 3 weeks and 6 months, which again improves the quality of life and the mental factor, which is very important.